The following program is being brought to you on the Voice America Business Channel. For more information about our network and to check our additional show hosts and topics of interest, please visit voiceamericabusiness.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Welcome to GlobeTalk with Avasant. Avasant is a next-generation global consulting firm that has its finger on the pulse of the global economy. Join us for an exciting look at the world economy. Now, here is your host, Kevin Parikh.
Our guest, Deepa Prahalad, is a business strategist specializing in opportunities at the intersection of consumer experience, technology, and strategy. As a leading management consultant, she has a wide experience in both multinationals and startups. Her expertise is not surprising. She is also the daughter of the late C.K. Prahalad, distinguished university professor at the University of Michigan and renowned global business strategist. Her latest book, Predictable Magic, co-authored by Ravi Sani, seeks to unlock the prescription for innovation in consumer products. Deepa, welcome to the program.
Thank you so much for having me, Kevin.
So what motivated you to write Predictable Magic?
Well, I worked with Ravi Sani of RKS Design, and I thought the approach that they take to product innovation is counterintuitive but very compelling. The basic premise is that people gravitate toward the things that make them feel good about themselves, and a lot of marketplace failures can be attributed not to poor quality or poor pricing, but really there is something that creates a lack of connection or connection with different products. And what we realized from studying a lot of cases of successful products and designs was that what people connected with were the things that made them feel good about themselves. And I think the learning was that this connection actually fuels brand loyalty and creates a path to sustainable advantage for a wide variety of businesses over time.
Well, that's interesting. I think, I've noticed that a lot of people seem to love their iPhones. I wonder if Apple has the prescription on this.
Well, Apple is probably one of the most visible examples, and I think they're one of the interesting ones that have really translated a successful design into a source of advantage. If you look at their earliest success with, the iPod in the consumer product, after the Mac, what they really did was they just created a pleasurable way for people to connect with their music that was very simple, intuitive, and not very expensive. But there was really no new technology in Apple. And if you look at what they've done today by creating an entire experience around the store and really connecting and having a rich dialogue with consumers, today they're really able to co-opt the expertise of 140,000 programmers who are essentially working for them for free, hoping that one of their apps makes it. That's a pretty powerful advantage that they've created, and, their stock performance speaks for itself.
So what you're really talking about here is the connection between technology, innovation, and business, and coming forward in a way that's really designing a product that's exciting and interesting to a customer that they can feel really, close to. What does the industrial designer play in product and service development? Since you mentioned these is the industrial designer the same thing as a software designer?
No, the industrial designer deals more specifically with the looks and the functionality of the product itself. They would do everything from colors, textures, materials, to speccing out for manufacturing. And I think there's some specific skills they bring to the table that are interesting. Historically, people used to come to designers when they had a concept, and they were mainly the ones involved in making it look good. But today, with new technologies, when there are a lot of functions that never existed before, people have to be motivated to adopt and try something out. And I think especially with technology, it's kind of interesting that we've always had this dichotomy in mind about science versus art. But if you really look at some of the examples of great design, they're from the technology space. Because you have to create an aspiration level for people to even pick up and try a product that they're not really sure they need.
What I found remarkable about your book is I think when most people consider innovation, they think of something that has yet to be invented, right? And as a result, having a process for innovating on a regular basis it seems almost impossible. In fact, many people would argue that innovation is by accident. We only have to look back in history to see how most innovations seem to have come about by some accidental thing, an apple dropping on someone's head, for example. So, so what exactly is your prescription, and how is this something that we can replicate?
Well, I think that there are different legitimate models of innovation. There are times when an entrepreneur simply has a great idea. There are other times when a large corporation may look at data or customer feedback and see that there's a latent opportunity. What I do think, though, is that for an innovation to ultimately succeed in the marketplace, what you do need to do is look at the data, but also take an explicit look at consumers' emotions, what will make them feel good about themselves, and therefore you can really understand that and de-risk your final offering, because you would have taken away a lot of the things that prevent people from adopting. I mean, there are tons of examples on every store shelf of products that work quite well, that don't look bad, and are well priced, and yet we know from looking at aggregate data that about 80% of new products fail. And that's because there's nothing special about them that connects with the consumer. And I think explicitly looking for that connection as you're designing, rather than waiting for the great brand campaign or ad campaign to cover up or create a temporary demand, is one of the ways we can help make innovation more successful.
Interesting. So you perceive advertising as potentially covering up weaknesses. What's the role of advertising, though, to really help promote great products?
I don't think it's covering up. I think what's really interesting right now is that the world of ads, a world of branding, and the world of design those boundaries are really morphing. If you really look at most of the products that have great advertisements, they also have great products, and it's not surprising because what they're doing is they're really leveraging that deep emotional understanding and connection they have with the consumer. A lot of times when we see really, really terrible ads, it's not such a good product, and a lot of those things are simply forgotten. But what we have learned from the companies that do a great job with design is that a great design can be the advertisement, and I think that's a really encouraging thing for both an entrepreneur and for a company as well, because now with the internet, with people getting information from so many different channels, to some extent, being able to break through the clutter with a great design is not only a financial benefit, but you can do a lot of your own advertising through the design. I think, a flip cam or a lot of these other examples where it's just so cool, people want it or want to find out more about it, is its own advertising. Right.
And I want to dive into this emotional connection that people feel for consumer products as well. And maybe we can dig into that a little bit, because to me, so much of this is about creating that emotional connection. Is that by accident, or is that something that that we can sort of predict magically?
Well, I think there is a process by which you can understand. I think the companies that really look at emotion, the final design may be very different. I don't think that it leads you to one specific answer, but that awareness, I think, creates disciplines in companies that help them innovate successfully. I think one of the really interesting studies that backs this up is from a book called Firms of Endearment. And what they did is, we had always, previously, most people analyzed stock returns and then tried to go back and look at what were the common traits across those companies. They took the opposite approach. They just went out and asked large samples of people, what are the companies you absolutely love to do business with? Would you drive a few more miles to do business with them? Would you pay a little extra? And what they really found from looking at the companies people loved was that the stock performance was actually superior even in categories that were slumping. For example, JetBlue and Southwest Airlines were among those companies, and yet the airline industry, we all know it's a familiar story of decline and poor service.
And disappearing bag service.
Yeah, and what you really find is that there isn't a single aesthetic to any of those companies. They're everything from budget of IKEA to BMW. But what they're providing is a consistent experience that people value. And what they've also found is that looking at their stock performance over time, that the people who focused on making their consumers happy, their goals, their performance was about even over time. Over 3 years, the performance was 1.7 to 1. And over 10 years, what we got was a real, 3.7 to 1 performance. So what we're really seeing is that focusing on emotional performance and looking at consumers and how they interact with the brand creates a source of advantage that grows over time, whereas focusing purely on cost saving tends to be something that people can copy more easily.
Interesting. So I actually see two issues here. One is consistency, right? So consumers can see and know what to expect when they buy the brand, right? The other one is quality. And this kind of comes to my mind because McDonald's, for example, which I know is not necessarily a consumer product as we're talking about today, but I recently read a study saying that they rank number 4 in overall taste of fast food chains. Yet the consistency of their product is incredibly, how should I say, their whole entire supply chain process is very consistent. No matter what country you go in the world, if you order a Big Mac, you know exactly what you're going to get. And they are the sort of number 1 hamburger producer. So there's this concept of quality and customer experience, and there's also this concept of consistency, and how do they blend together?
Ideally, you don't always see a one-to-one correlation, because I think there are different reasons people consume McDonald's, and I think sometimes when you buy there, you're not necessarily looking for quality alone. That's not where people go if they want a great meal, probably, especially in America. Maybe
a fast meal, right?
Yes, but you do know what to expect. You know it'll be delivered consistently. If you're traveling, you're pretty sure you're going to be able to get a clean bathroom, for example. Those are all parts of it. I think predictability is an important part of that experience, and you also have, and they have upgraded. They have taken cues from a lot of other trends that are taken. Let's not underestimate. They've added salads, they've added coffee, they've added Wi-Fi in some locations. So they're picking up cues, but they're very strategic in how they deploy those. And I think more importantly, though, there's really this perception that, experience must be expensive. And I think McDonald's is a great point, in fact, that the consistency and quality of experience that people are looking for can be achieved, it can be upgraded, and doesn't always correlate to a huge increase in price. It's more the awareness and understanding where to make adjustments that matters.
Deepa, we're going to take a quick break. We're here with Deepa Prahalad, co-author of Predictable Magic. 2-minute break for our sponsors.
When it comes to business, you'll find the experts here. Voice America Business Network. Are you ready to grow your business? Listen for the Independent Business Owners Show with your coach, Rick Corrado. This entertaining talk radio program will bring you the tools to help increase your business. You'll learn sales success, time management, lead generation, business development, life balance, and much more. Rick Corrado is here to help you take your business to the next level. Listen for the Independent Business Owners Show, heard live every Monday morning at 11 a.m. Eastern Time, 8 a.m. Pacific on the Voice America Business Network.
Avasant, your management consulting firm for the next generation, providing sourcing advisory, globalization, and go-to-market strategies. In an unpredictable world, Avasant is your trusted global advisor. Learn more about us. Go to www.avasant.com. That's AVASANT.com.
Source, providing global sourcing solutions for IT and business process services. We offer call center sales and support services at the highest industry standards. Cape Source, world-class IT services straight from the heart of Africa. Learn more about us on the web at www.capesource.org.
It's Your Money with host Bill Pfeifferlich. You'll get an eye-opening education about some of the misconceptions of the financial world. If you are a business owner, working professional, or successful American, you will benefit from the information on our program. Our guests will include financial service professionals, international tax and estate attorneys, and CPAs. We'll identify solutions that you can implement now to get the most of your money. Tune in Tuesdays at 4 p.m. Pacific Time, 7 p.m. Eastern Time for It's Your Money on Voice America Business.
When it comes to business, you'll find the experts here. Voice America Business Network.
Listening to GlobeTalk with Avasant. We're here to answer your questions about the global economy. Please send an email to globetalk@avasant.com. That's globetalk@avasant, AVASANT.com. Now, back to our program. Here's Kevin Parikh.
We're back here with Deepa Prahalad, co-author of Predictable Magic. Deepa, as we kind of drive into this paradigm of innovation and also examining consumer products and what motivates people to buy them, how does the current economic environment play to brand loyalty and especially given what many people are arguing is a lack of consumerism, which is surprising to say today in the United States, given lack of credit faculty. How is that impacting consumer products?
Well, of course, everyone feels the downturn, Kevin. I mean, that's obvious. But I do think there's some very interesting cases that are coming out of this recession, and that is really, backing up our premise that people make choices and what they connect with, they don't easily change even when circumstances are tough. They do trade off other things. You know, what we find is
like
look at how well Apple is doing with fairly expensive devices in the midst of this recession. And we do know that people tend to stay bonded to a very peculiar basket of goods, if you will, like detergent, their branded liquor and beer. While they will be happy to trade off to store brands or go without many other goods, they have a very select group of things that they will not trade down. People, for example, are not trading down their mobile devices even when they have to move, when they have to leave their homes, change jobs, whatever it is. And I think that's what we speak to, a lot of the emotional needs and understanding what people really need, that sense of connection, some sense of continuity in a few baskets of goods. It all speaks to the value of emotion, and companies really need to understand that.
Right, so these are core products like, your favorite soda pop or toothpaste or detergent. But what about high-end products? How are they affected? I
think people consume less, and the other response to recession for people who aren't absolutely stretched as much is they make very different decisions. And I think there, too, they want to feel good about themselves, and there's fewer and fewer sets of goods that can do that for them at a reasonable price. Or they say, if I'm going to splurge, I'm going to splurge on one thing, and it has to be perfect. And there, too, that's where understanding consumer as an individual and what they need matters more than looking at, masses in aggregate. Because when you can make that connection, you have a better chance of appealing to as wide a range of people as possible.
And it strikes me that, when we talk about unleashing, as you say in the cover of your book, Unleash the Power of Design and Strategy, even economic shifts give an opportunity to unveil new innovative products that meet the needs of that economic period. And I can't help but think about the Great Depression and our current recession as well, and what types of products seem to be becoming more popular because of that.
Yeah, and what you see is that some of our great companies did start during the Great Depression, because I think when there's an atmosphere of scarcity, what you really find is the companies that are able to survive those circumstances have to think differently. They have to think deeply about the consumer, because the fight for every dollar is that much tougher. And what we're also seeing is some very preliminary evidence, which is just that. It's preliminary, that companies that have tried to engage with people in emerging markets and have had to learn how to develop things at lower price points and have more innovative business models are being better able to cope with the recession here at home. by being able to lower their costs, being able to offer more innovative products.
So let's shift gears a little bit and talk a little bit about quality versus design.
I don't really see them at odds with each other. I think there is a persistent belief that there's this trade-off between style and substance. But the data really shows that, the companies that have the luxury to focus on design, that really happens when you've already mastered quality, distribution, and you have some type of connection with your consumers. Quality is important, but it's really the price of entry in most industries. Even a lot of infomercial products more or less work the way they say they will. So it's not really enough. And I do think that now people understand that design is really a way of conveying quality. You look at a company like BMW or something else, that design is a signal to the consumer that there is quality engineering that went inside because it's not clunky. I have all this power, but I'm still sleek, I'm still efficient, and I have the best engineering. So I think you really look at the companies that are high design, Google, Coca-Cola, HP, Procter & Gamble, they're high design and high performance.
Yeah. And I think also when consumers today have maybe fewer dollars or pounds or whatever to spend, my sense is that they are looking really for both, and they're being more discriminatory in what their decisions are for buying products.
Yeah, I think here it's really a case where, what's true in the lives of individuals really applies to companies. When you're exhausted, overwhelmed, you're confused about what's next, you never really look your best. And consumers pick up on those cues from companies as well. Whenever you see, a dirty store, picked over merchandise, bad service, you come to your own conclusions about that company's fitness. I mean, it's really, when you focus on design and connecting with consumers, it's just like putting on your best suit to go into an interview. You're really showing the consumer that you care about the relationship.
You talk about the Internet and the impact of technology in making decisions, having a lot of data to be able to make right choices as a consumer, and also, of course, the emotional aspect. So how is the vast amount of data that's available to a consumer today impacted their changes over the course of the last decade?
Well, we know they're doing a lot more independent research before they buy anything. And we also know what's interesting is that a lot of people buy things and they go back to do additional research to validate their choices, which is not something we would have even thought about 10 years ago. I think for companies, however, like that data collection needs to be managed very carefully. They must take a look at the data they have and draw inferences. But if data is all they looked at and did not look at emotion, you wouldn't really see a lot of the big business stories of the past decade. And let me give you a couple of examples. I mean, if I had looked at the data on emerging markets in terms of income, even 5 years ago, I'm not convinced any global cell phone carrier would have gone out and said, oh my God, what a great idea to go there. But that's where the growth in cell phone markets is, and that's because somebody said, look, these people have as much a need to be connected as anybody else, and it's our challenge to find a way to make this affordable. I mean, if I even look at a much simpler case like a flip camcorder, if I kept polling, the 16% of people who comprise 80% of the reviews, I would be adding more features, more pixels, all kinds of other doodads that may or may not add value.
You cover the flip cam in the book, and I found that personally interesting because I own a flip cam. And the interesting thing about it, to personalize it from a branding standpoint, I purchased it because I was so impressed with the capability to take a video and have it in my pocket and be able to do things very quickly and efficiently and easy. But one thing I learned is that there was very poor customer service, and when something didn't work on it, particularly the charging aspect of it, I found millions of complaints, and they didn't seem to have addressed any of them. I'm not sure I'd buy another flip camera, even though the technology is really great.
Yeah, and I think that's where we come to the point of view that design, it can attract a purchase, but it must be followed through in a point of view, and how you treat customers throughout the whole experience is important. I think what we've got to do is really understand that design alone is not a magic bullet. I don't think that's the argument we're making. I mean, you have people who design wonderful things sometimes, and they fail for all of the reasons you've talked about. I think that point of view really needs to be carried through, and that's why it needs to be part of the whole organization's learning. On the other hand, though, even coming up with that design, it took a very counterintuitive view. They said, let's not keep looking at the people who are buying and trying to sell more. Let's look at why people aren't buying it. And then you realize that there's a whole big opportunity. And what FlipCam did do was open up the market, and they let people know there was an opportunity. And if they don't follow up with service, there will be other people who can build on that and fill those gaps.
And we're seeing it, right, with tremendous competition in that industry. Well, Deepa, we have time for probably one more question here before we have to go to break. But developing a product or a service can be obviously financially risky, and given the unknowns in the consumer marketplace and the high rate of failure, how do we make these more predictable? How do we make these kind of investments more predictable so that we're minimizing our risk?
I think we always tend to have this belief that people are always looking for something new. I think what people are looking for is evolution, and I think the really exciting impact of the Internet is that the company doesn't really have to have all the answers. What they really need to do is figure out how to build a rich dialogue with consumers by putting something out there. And when you do that and you establish a connection, a lot of times consumers will tell you where you went wrong, and they'll help you change course. And I think there's some really interesting examples of that. I hate to harp on Apple again, but really, because people have a connection with Steve Jobs and Apple and what it stands for, he can actually mess up his demo at a major trade show, and people laugh about it and say, oh, wow, it's a sign he's human. I can't imagine that if Steve Ballmer made that same mistake, people would be quite so forgiving.
Well, Deepa, thank you so much for joining us. This has been a very interesting discussion, and I really wish you great luck on your new book, Predictable Magic.
Thank you so much, Kevin.
Our next guest, Dr. Joe Greco, an expert and financial analyst at CSU, examination of Obama's new health care reform initiative, the Patient Protection and Affordable Care Act. So we look forward to hearing from him. Thank you again, Deepa.
From the boardroom to you, Voice America Business Network.
Go inside the world of PR with PR Insider, hosted by public relations expert Maureen Kettis. Maureen will speak to the world's highest profile PR pros from the fields of marketing, advertising, and sales. And PR Insider will feature renowned members of the media as special guests. Maureen will give you a VIP access pass, including tips and tricks to take your business to the next level. PR Insider with Maureen Kettis, sponsored by Cision, us.cision.com. Listen every Friday at 1 p.m. Pacific, 4 p.m. Eastern Time on the Voice America Business Network.
CapeSource, providing global sourcing solutions for IT and business process services. We offer call center sales and support services at the highest industry standards. CapeSource, world-class IT services straight from the heart of Africa. Learn more about us on the web at www.capesource.org.
Are you looking for innovative ideas on how to achieve your financial dreams? Tune in to Empirical Investing Radio every Thursday afternoon at 2 Pacific, 5 Eastern on the Voice America Business Channel. Join certified financial planners Ken Smith and Ethan Broga to learn how you can obtain financial success. You'll be entertained while you discover techniques to alleviate your financial concerns. Empirical Investing Radio every Thursday at 2 Pacific, 5 Eastern on the Voice America Business Channel.
Avasant, your management consulting firm for the next generation, providing sourcing advisory, globalization, and go-to-market strategies. In an unpredictable world, Avasant is your trusted global advisor. Learn more about us. Go to www.avasant.com. That's AVASANT.com.
Voice America Business Network, the bottom line in business.
Listening to GlobeTalk with Avasant. We're here to answer your questions about the global economy. Please send an email to globetalk@avasant.com. That's globetalk at Avasant, AVASANT.com. Now, back to our program. Here's Kevin Parikh.
Welcome back. We're here with Dr. Joe Greco. He's a financial expert and analyst. He has a PhD in financial economics and expertise in international business. He's also a professor at CSU Fullerton and is the CEO of Global Financial Strategies, Inc., his personal consulting firm. Recently, Dr. Greco has been focusing his research on the financial and economic impacts of the new Obama administration healthcare reform initiative, the Patient Protection and Affordable Care Act. Today's program is to understand the real impact of the legislation. Welcome, Dr. Greco.
Hi, Kevin.
So as we all know, the healthcare reform bill just became law in March, and the implementation has already started. Can you give us some background on the financial imperative that drove the push for this healthcare reform?
Sure, Kevin. One of the things that was pushing it the most was the rate of growth in the healthcare costs. Deloitte did a study and found that the healthcare costs were growing at 6% a year, where our economy, especially in the last few years, was growing at most 3% a year. So it wasn't sustainable.
So, I mean, you know, when you say it wasn't sustainable, it's just because the spend was just increasing and eventually was going to make healthcare unaffordable.
That, and there were other complications that added to the, you might say, the compelling nature of the reform. Some people had done studies that showed that one of the most common forms of personal bankruptcy was healthcare costs that they couldn't pay. There was some studies have found that about 46,000 people die a year that don't have insurance. So there were other more compelling reasons too.
So at a very high level, can you explain for our listeners, many of them maybe still unfamiliar with this new reform, what the primary goals and objectives are of the Act?
Sure. The primary goals over the next 10 years will be, first of all, to slow the growth of the costs that we just described. And number two, to expand the coverage to approximately 30 million more people, and in particular children of the workers. And then to reform the delivery system to make it more efficient, improve the quality, and, of course, increase the access.
So, okay, so basically more access, more coverage, lower cost. How does that work?
Yes. How does that work? Well, that's going to be interesting to see because we're talking about one of the largest industries in the United States that employs approximately 14 million people, and if it was an economy, would be the seventh largest economy in the world. So it's all unfolding, and a lot of what we talk about today is preliminary. It's still a process, a work in process as far as finding out the implications and the impacts.
Well, it's pretty clear. I mean, any study that you look at, and I just read one last week, healthcare spending as a percent of GDP, the United States is by far the highest, and we rank overall by the World Health Organization around 37th in terms of the performance of the U.S. healthcare system. I think this is tremendous. As you said, also spending is expected to continue to rise, even though we're already the biggest spender. So the legislation, as I understand it, it's going to cost about $940 billion over 10 years. Is that all coming from taxpayers?
In terms of expenditures, if you're talking about the government expenditures, probably it's going to be they're making certain programs available now to people who are you might say increasing their electronic medical records, and so that's coming from the taxpayer, no question about it.
Right, and then but this is hopefully counteracted by better patient quality, more consistent care, more preventative medicine focused on electronic standards, medical records, et cetera, right, to help counterbalance that investment?
Well, again, this is still, we're not clear exactly what's going to happen, but the forecast that we do have from, the people like Deloitte and Ernst & Young are saying somewhere around 3.2 million new jobs will be created in the next 5 to 6 years, and that's just from the major segments. And when I talk about the major segments, I mean the hospitals, the nursing care facilities, the physicians' offices, dentists, home care, and ambulatory healthcare services. But there's a whole host of other impacted industries that we think will also generate more jobs.
That's a great point. I mean, I understand one of the things that the bill is going to do is put almost $37 billion into a standard electronic protocol standard for medical records. Do you see that industry growing as well, as quickly, I would imagine?
Well, I have a particular point of view that I've been developing since I've spent so much time on research on this, and one of them is that there probably isn't enough of the workers in America to do all that's required. So we're going to have to go offshore to get some help to make this reform work.
So this could potentially benefit companies overseas. I don't know if that's what the Obama administration envisioned.
Well, the rest of the world is watching. We're not the only country in the world that's looking at healthcare reform. And so there's opportunities for other countries to learn from what we're doing.
So since the implementation of the new law, and I appreciate that, and maybe you can chat about this too, that it's kind of being phased in, what changes have you observed already in regards to cost containment and in terms of rollout?
Well, one of the things that I've been researching is just exactly what has occurred, and it started mainly in September, and some of the studies by, and mainly Deloitte, have said that there's really a choice now that companies have. They can do some IT planning, most often related to the benefits their employees are going to have or expanded in the future, or workforce planning, which some consultants are saying that requires what we call scenario modeling to come up with, you might call it the total impact price tag of what's going to be involved in this next year. So right now, it's a case of planning that is coming out. There's companies that are being advised to do both, IT planning as well as workforce planning. Interesting.
So when you say IT planning, that means that what? Does that mean hospitals are making more investments to upgrade their healthcare technology systems? Does it mean that insurance companies are changing their technology backbone? What does that mean?
Well, specifically, at the present time, what they're talking about is having a focus on employee benefits, for example. A big driver of the legislation will be insurance reform. So employers are likely to face requirements of minimum standards of coverage. So they can, first of all, do some planning on that. Or on the other side, they might, as far as IT planning, they might look at some of the ways that they can streamline what they're doing, how the employees are signing up, how the employees are claiming, how the claims are being processed. That kind of IT planning is going on right now.
Right. So, when we think about, payer functions, right, we're talking about document management, claims processing, coordination of benefits, and all of that sort of falls within that technology rubric. What do you see claims processing changing, for example? Do you I understand there's a lot of investment on technology, but are we looking at new and more innovative ways to ensure reimbursements can be more speedy?
that's an opportunity. I don't see any thing happening yet, but definitely that. Let's face it, there's going to be more costs for some employers, mainly because they're going to have to take more of their employees into their insurance benefits, and especially their children. That's going to be required in the years to come.
How's that going to impact small businesses?
Now, that's in my research. I've come across it's going to vary. Some companies, it won't even be an event, according to some of the accounting firms that are advising these firms. And in some cases where you have a lot of part-time employees, there's going to be a new definition of what a full-time and a part-time employee is and who you need to insure in your health care plan. So that's going to be, for those kind of companies, a major impact. And for the hospitality industry especially, where there's a lot of part-time workers, there will be some impact, increased costs.
Are there some, and I don't know if you're aware, are there certain financial bans for that? So companies under X million are required or not required? What are the thresholds?
I'm not familiar with that right now, Kevin. I can't say what to say. I don't know what to say about that.
Okay. So if we can shift a little bit to, right before our break here, we're going to shift a little bit here to the solvency of Medicare. And, with the new law purportedly extending the life of Medicare Trust Fund, can you tell us how it will enable that and actually stabilize that Medicare Trust Fund?
Well, some of the approaches that the new law is encouraging will be a dramatic change in the way healthcare is delivered. And one of them will be the reimbursements for Medicaid and Medicare will be reduced. And so there will be savings that they're projecting for those two. And that, of course, will force some companies that depend on that reimbursement just to find ways to become more profitable. Personally, I see the IT sector benefiting from that.
Well, thank you, Dr. Greco. We're going to take a quick 2-minute break for our sponsors. But when we get back, we're going to dive into this issue some more and understand what the Patient Protection and Affordable Care Act means to all of us.
The business community's first choice in Internet Talk Radio. Voice America Business Network.
Avasant, your management consulting firm for the next generation, providing sourcing advisory, globalization, and go-to-market strategies. In an unpredictable world, Avasant is your trusted global advisor. Learn more about us. Go to www.avasant.com. That's AVASANT.com.
Are you thinking about starting a nonprofit? Or perhaps you've already started one and want ideas, inspiration, and encouragement? Tune in to Nonprofit Spark with your host, Renee McGivern. Our program will feature as guests the leaders of emerging nonprofits who will share what works for them. We also will hear from experts who offer advice to make your jobs easier. Tune in to Nonprofit Spark, and together we'll create a world that works for everyone. Nonprofit Spark airs live Thursdays at 2 p.m. Eastern, 11 a.m. Pacific on the Voice America Business Channel.
Source, providing global sourcing solutions for IT and business process services. We offer call center sales and support services at the highest industry standards. Cape Source, world-class IT services straight from the heart of Africa. Learn more about us on the web at www.capesource.org.
When it comes to business, you'll find the experts here. Voice America Business Network.
GlobeTalk with Avasant. We're here to answer your questions about the global economy. Please send an email to globetalk@avasant.com. That's globetalk@avasant, AVASANT.com. Now, back to our program. Here's Kevin Parikh.
Welcome back. We're here with Dr. Joe Greco, professor at CSU Fullerton, an expert in financial economics and expert in international business. We're talking about the Patient Protection and Affordable Care Act. So, Dr. Greco, maybe you can tell us a little bit about how the new law will enable technology companies to assist in reducing waste, fraud, and abuse in not only the healthcare system, but the Medicare system.
Sure. One of the things that is generally accepted is that healthcare records are going to be electronic. And there's really two types of healthcare records here. One is just what we call electronic medical records, and the other is a much more extensive listing of the patient's history in the healthcare industry, and that's called the electronic health record. And one of the things that the government is actually encouraging right now is converting these paper records to electronic records. So there is a definite impact in that industry as more and more of these records become required to be electronic. Right now, only 46% of all the records in the United States are electronic, as compared to, say, a country like the UK, where it's 100%. We have a lot to do, and the IT sector that is responsible for converting those records is definitely an opportunity now, and one that's going to see a lot more business.
Interesting. Well, post 9/11, we saw an increasing number of IT jobs go overseas in offshoring and outsourcing, and in part, many would argue because of the unavailability of visas to come to the U.S. With much of the industry now diversified in countries like India and in Eastern Europe and Brazil, and now also emerging in Latin America, how will we be able to retain these jobs, or do you perceive these technology-oriented services having to be performed overseas, even claims processing, for example?
Well, as I said earlier, Kevin, the magnitude of this industry and the magnitude of the reform that's planned is such that we're going to have a shortage of workers in the United States for this industry. And so we're going to need help from abroad just to convert some of our medical records to electronic formats. In addition, if we're going to be more efficient and cut the waste, we're going to have to involve, I think, the IT sector more, and that's going to put a greater demand on the employment in our IT sector here at home. So,
I understand also there's some countervailing provisions designed to strengthen HIPAA and protect medical records from going overseas. So this is going to be a challenge. Well,
they're doing that now. So an industry, say such as the Indian IT sector, already knows how to protect the HIPAA or to abide by the HIPAA compliance. It's not something new. It'll just be something that they're already the experts. Yes. Mm-hmm.
Interesting. So you see India as a primary region here with the aspect of BPO, claims processing, and IT as a primary location, or will other countries support as well?
Well, this is getting more into my area. One of the things that the Indians have become famous for is IT outsourcing, and especially software development. Software development is going to be an important part of the healthcare reform, and just the fact that we have now the idea that we need to become more efficient, and certain things can be put into a software program to make them more efficient. So the Indians have become the world-famous examples of software development. But I also study China very closely, and China is looking to compete with India in this sector, and that's not the only country. Other countries are looking to compete in the IT sector also. So we have companies and countries standing by, looking and ready to help us to make this reform, a success.
Well, and I think, from what I can see, too, that's okay. In fact, that might, help us achieve our cost reduction expectations and also our service expectations.
Well, as I said, my thought is that we're all in this together in terms of other countries are looking to reform their health care, too, and we're going to be a model for learning. And so there's going to probably be jobs created to help other countries from the United States. So I see it as a very much a two-way street now as far as employment and spending and so forth.
I guess unavoidable in the global economy, right?
Exactly.
So the Obama, just to summarize this, we just have about 3.5, 4 minutes left. We've got a tremendous amount of investment, particularly around technology, to help reduce costs and provide better services to patients, to a broader number of patients. So in many ways, this could be viewed as a very innovative act, and also looks like it could promote better business partnership overseas with technology providers as well.
I would agree. I would agree most definitely.
You'd be a proponent of the legislation then?
Well, let's put it this way. I'm cautious about it because it has such magnitude in terms of, as I said, the employment and the amount spent annually. The opportunities are definitely there for us to reform some of the things that needed to be reformed. Without getting into too much detail right now, it's just going to be a major change in how we view and access healthcare. So
now you talked a little bit about some of the technology aspects of this. Are all the cost savings going to come from being more efficient, cloud computing and technology, or do you see there's being some real process opportunities here as well?
Well, I've also spent some time studying how social media is changing the business world, and I believe that social media technology can be applied to the healthcare reform and also be have a major impact on how we deliver healthcare and how, of course, we hear back from the patient and the healthcare providers.
So you're talking about Facebook and MySpace and those types of technologies and applying them to healthcare?
Exactly. I think there's an opportunity to get what we call now crowdsourcing from the people involved in the healthcare business as well as the patients, so that there's more communication in a less expensive way. Right now what we have is, patients appearing at the doctor's office or the hospital, and we have some of the most expensive tests done and done again and again, and that adds to the cost. Well, there are in place in the legislation some new ways to make sure that that is not so much the primary way we do the delivery of healthcare now. So I see the social media being, believe it or not, one of the ways that can replace some of the more expensive methods we have now.
Well, it's clear that something needed to be done, particularly with advancements in technology today, and the upgrade of the healthcare system was something that was required. It's probably still yet to be seen whether this legislation will achieve that or at least get us in the right direction. So thank you so much, Dr. Greco, for joining us.
It's my pleasure, Kevin.
It's been a great hour. Thank you again to both of our guests, Deepa Prahalad, author of Predictable Magic, and also Dr. Joe Greco, professor at CSU. It's been a stimulating afternoon. Thank you.
hope you enjoyed Globe Talk with Avasant for this week. We'll be here again next Friday at 3 p.m. Eastern Time, noon Pacific, on the Voice America Business Channel. Please join your host, Kevin Parikh, and have a nice weekend.